We've talked a little bit about, from the point of view of students and clinicians, what it takes to be a bilingual SLP. The question also really could incorporate employers. What should employers look for when they hire clinicians who would like to practice as a bilingual SLP? What would you say that employers should look for?
That's a great question. I think that we're always working with family members. If you're working in the school system, you're working with parents or other family members. If you happen to be working in a medically related area, you're also working with family members. You're working with perhaps the children of the adult that you're working with who's had a stroke or has dementia issues. Mm-hmm. And so I think it's very important to have that cultural competence and that ability to establish rapport with other family members and enlist their support in terms of working with the client mm-hmm. or student that you're working with. Mm-hmm. And of course, it's also very important to be able to talk and communicate with other professionals, mm-hmm. other teachers, special education teachers, classroom teachers, perhaps medical doctors, psychologists, and other professions. Be able to converse and communicate on behalf of your client's needs, mm-hmm. and also recognizing that if you're working in a bilingual environment, that these conversations may be taking place in the other language. It's also very important to know that bilinguals, let's use, for example, Hispanics, Latinos in the U.S., that they are a very heterogeneous population. That in the U.S. we have a large Mexican-American population, we have a large Puerto Rican population, we have a large Cuban-American population, individuals from Central and South America, and to recognize that there's a great diversity in terms of language and customs and culture and practices in working with mm-hmm. this heterogeneous population. So an employer should look for the clinician to be able to work with those different populations. And of course, you use evidence-based practices in terms of assessment, in terms of treatment, to use what's effective, what does research say in terms of what's effective in working with different clients.
Mm-hmm. Okay, so employers during the interview process should inquire about the language proficiency.
Yes.
It'd be nice if they could even hear a sample to verify, if at all possible. And then based on what you're saying, it might be a very good idea for employers to ask for specific examples of when they've worked with families, how they've handled some challenging situations, how they have provided a rationale for their assessment and intervention practices based on best evidence for diverse populations,
right.
those types of
right.
things. So really getting at some more evidence.
Giving us more evidence and getting the employer to ask for that clinician's background. And again, stressing to the employer, it's not just the language skill that makes them qualified.
Mm-hmm. Excellent.
And so that they have, a good history of being able to work with bilingual clients. Mm-hmm. I recall one instance where I had a little child, a young boy of a year and a half, and his first language was Chinese. And he was also being exposed to English, and so I worked with the parent in terms of she was able to come into my sessions and basically translate mm-hmm. for me when he was using Chinese as his medium of expression. Mm-hmm. And also, so we worked with this child in terms of using sign language, English, and Chinese in a tri-modal format, and it worked well. But then again, you have to have that flexibility of being able mm-hmm. to see what tools you have at your disposal, and it's going to go beyond your natural proficiencies. Mm-hmm. And so learning how to work with parents, how to involve parents mm-hmm. in that situation was really a necessary skill.
Mm-hmm. Good. So examples of flexibility and problem solving.
Exactly.
Good. And this makes me think of another good question for employers, given in one of our previous videos we talked about what it takes to be a bilingual SLP, and one thing we mentioned was how to address parents' questions about bilingualism. So that makes me think that would be another good question for an employer, is how they've counseled parents before, just to have them demonstrate that knowledge base, given that these are things that, again, someone might be bilingual, but again, it's that training, that additional
right.
knowledge and skill, how to handle these real life situations.
For life situations, and of course a parent wanting to be able to maintain the native language in the home, but also recognizing that that was a medium that the child communicated with, and so we had to incorporate that as part of the therapy strategy, is to include that Chinese language background in terms of therapy and also the home. And so recognizing the parents' needs and being flexible, and recognizing that good input is good input, and not necessarily becoming fixated on just one, recognizing that good input is good input, and once that child understands that input and is also able to express themselves, that they'll be able to use it across the different modalities, from signs to words in English to words in Chinese, or any of those directions.
And I'd like to give an example also. Some previous students of mine a few years back had an interview with some agency here in Florida, actually, coming from the Midwest, and they ran to tell me about it afterwards, and they were so excited. I was actually really happy with the employer because they were clearly the hiring person knew a lot about bilingualism and wanted to make sure she was recruiting strong clinicians who, again, beyond the language proficiency, and the recruiter or employer was asking my students some really tough questions, and hopefully having had my classes, they did very well and were very excited to tell me, but that made me happy as well. Not only did my students know, but it was really nice to know that employers are actively seeking strong clinicians, again, beyond the language, because again, what employers need to know is that their clinicians represent the agency. So it's really in employers' best interest to also make sure that their people they're hiring know their stuff.
Oh, thank you.
Alrighty, thank you. This was a good topic again, I'm sure beneficial for many of you out there.